I'm Dr. Catherine Kwan. I'm a specialist in diseases of the kidney and also high blood pressure, and I'm in practice at Lake Michigan Nephrology. We're in St. Joseph at the Royalton Medical Center. We're directly across from the YMCA on Hollywood Road. We also see patients in Niles on Meadowbrook Lane at our dialysis unit and at the medical center in Coloma. The kidneys are the focus of the nephrologist. When you're told that you need to see a kidney doctor, it can be really frightening and overwhelming. Kidney disease is not well understood, and instantly you've got a lot of questions and fears and worries. I know that that's a really important job that I have there, to let them know that there's going to be a team that's helping them to get through these difficult times. And educating them about their options, so when they come back and having learned a little bit more and realize that they are going to be okay and that we're going to make them a customized plan to get them through this, that's also rewarding. I grew up in Washington, D.C., but I returned to St. Joseph because my father grew up in Benton Harbor, and I'd been coming here every summer in my life to see my grandmother. So when I got an email saying that they were looking for a nephrologist in St. Joseph, it seemed like a great opportunity, and I've now been here for about 9 years. My husband Chris and I have 2 boys, Jonathan and Alex. We love the lake, we love the beaches, we love the fresh fruits and vegetables and all the farm stands. It's a nice pace of life in a community that really values family time. I went to college at Swarthmore College in Philadelphia. I did medical school at Albert Einstein College of Medicine in the Bronx in New York City. I then did my residency in internal medicine and my fellowship in nephrology at the University of Virginia in Charlottesville. We see adults, so from age 18 and up, and we go as high as 102 currently. A lot of the times when I'm meeting somebody, they feel fine, and the reason they've been sent to me is because their family doctor has noticed an abnormality on the blood tests or the urine tests that suggests that there might be a problem with their kidneys. So they're often surprised to hear that they need a kidney doctor, but I'm very glad for the primary care doctors being so diligent, because kidney disease can be silent without symptoms for a long time, and you can miss an important problem if you don't have a family doctor checking. I also have a high blood pressure specialty clinic, and there we see patients who don't necessarily have kidney disease but have difficult to treat high blood pressure, and we've been very successful in that. We've started that clinic within the last year. We've already helped over 100 patients to get their blood pressure to goal. I think that we perform a very personalized approach to medicine. It's a small office, and when you come to our office, you're greeted by name. Our staff really treats you as family. You'll have the same physician seeing you in clinic every time. Our practice is on Epic, which is the electronic record that Lakeland has established and made available to most of the primary care doctors in the area. And what that means is that within minutes of me seeing a patient, their family doctor has my electronic note sent to them. I can email the doctor with any additional questions or comments, and so communication is seamless. And that makes sure that we're going to work exactly with your primary care team. The best part about my job is that what I do every day matters to the person sitting in front of me. Whenever a patient tells me how much they appreciated the small things, it reminds me again to take the time to do those. And so making sure that I speak compassionately, but also use language that they can understand and not retreat into doctor talk. To sit down in the hospital room, to listen to patients talk about their grandchildren or their hopes and their plans for the future. They seem like small things, and they can get lost in a busy medical practice where you're trying to keep up with the latest scientific recommendations, but that human touch is so important to patients, and when they tell me how much they appreciate it, it just reinforces my determination to try and bring that every day.